Hi, this is Molly Moon, and you are listening to an MDI Hospital interview on the COVID-19 pandemic crisis. This Zoom call was recorded at 9 a.m. on March 10th, 2021, and things may change by the time you listen to this. For the most updated information from the main CDC, as well as general information on the coronavirus, please call 211. If you have further questions relating to the COVID-19 pandemic crisis, please visit our website at mdihospital.org. Today, we have Dr. Trevor Casey with us. He is the Director of Pharmacy, Emergency Preparedness, Infection Control, and Rehabilitation Services at MDI Hospital. Trevor has taken a lead role in our vaccine administration efforts and is here with us today to answer a number of questions relating to the signing up and receiving of the COVID-19 vaccine at MDI Hospital. Again, things may change by the time you listen to this. Hi, Trevor. Thank you for joining me today and making time to connect with our community to answer a number of frequently asked questions.
Thank you. Appreciate the opportunity to be here.
Great, let's get started. Our first question is, what group is MDI Hospital vaccinating right now, and who is in that group?
So we're still doing our front-facing healthcare workers and anyone over the age of 60. And then newly last week, we're doing K through 12 educators and licensed child care providers at this time.
Wonderful. How do I sign up for a vaccine appointment with MDI Hospital?
Well, we are making some changes as we brought on those that are above the age of 60. We are implementing a call line. Last week, unfortunately, we were unable to start our call line because of the allocation of doses that we received didn't allow us to have enough doses to implement our call line. But we're expecting to be able to open that back up on March 12th. The call line will be open on Fridays and Mondays from 12 to 3. And you'll be able to call in and schedule your appointment. We'll have around 20 people answering the phone. So if it is busy, please call back, wait a few minutes and call back. And you'll be able to watch the MDI Hospital website for additional information about the call line and how to call in and schedule your doses. We are still doing outgoing calls for those above the age of 70 and for healthcare providers. We want to make sure that we're continuing to focus on those important groups and getting them vaccinated as well, and making sure we get everybody done. If they change their mind or if they were unavailable to get the dose earlier, we definitely want to make sure that we get those groups vaccinated, as well as those above the age of 60 and our education population as well.
In terms of the call line, how will the phone call go when I call to sign up? And will I receive a confirmation of my appointment date and time?
Well, so when you call, we'll answer the phone. We'll be excited to talk to you. First thing we're gonna need is your name, your date of birth. We're gonna need your address, your physical address. We know that many people don't receive their mail at their physical address, but the state of Maine is asking us to record the physical address. If you have an email address, we'll need that, and a phone number. We'll also need to know, how do you qualify for the vaccine? So we'll ask if you're an educator, if you're a licensed child care provider, what makes you so that you qualify for the vaccine? Are you above the age of 60? And so whatever that is, you'll need to actually provide proof of that. So if you work for AOS 91, you'll need to bring in your badge or a pay stub. If you're working for a licensed child care provider, you'll need to bring in a pay stub or a badge that would go with that. And then if you're above the age of 60, we'll need a Maine ID. We can only vaccinate Maine residents, so we will need a Maine ID or a bill or something along those lines that is going to show the proof of residency for Maine. You'll also be told the dates that we're having the vaccination clinics, and we'll have the times that are remaining that are available to get the vaccine. We'll ask you to wear a shirt where we can easily access your upper arm to give you the vaccine. We're going to ask you to show up on time, not early or late. We try to get people right in, and if everybody shows up within 5 to 10 minutes of their administration time, we're able to get them right in and get you out as quick as possible. We're trying to make this as efficient and painless as possible. We'll also be giving you the location. We're going to ask you to write that down so you know where you're going. Currently, we're doing the vaccinations at the Regency Hotel. This could change at any time, and we will communicate those changes with you. And then if you're a healthcare worker and you're coming in, we are asking you to bring in your Maine license. Only Maine licensed healthcare workers qualify at this time to get vaccination, and it has to be front-facing healthcare worker. So if you're an administrative healthcare worker, you don't qualify at this point in time. for the vaccine.
And
As
will there be confirmation of the appointment as well?
So that we'll definitely be given a verbal confirmation. There has been some challenges with the email confirmations going through because we're taking the email over the phone over the phone. Sometimes there's a typo, and there's some emails that definitely put the confirmation into the spam folder. So the verbal confirmation will be very important. It'll be very important to jot down that time.
And can you also remind me what the front-facing healthcare worker category looks like?
So that would be anybody that has direct face-to-face contact with the patient on a regular basis throughout the day. If you're working in fiscal in your back room or IT and you have very, very little patient contact, you don't qualify for the vaccine at this time according to the state's current guidelines.
So what I'm hearing is when you get the phone call, write down your confirmation date and time.
Yes, please.
Excellent. So what about during the phone call? Will MDI Hospital ask for any payment over the phone?
So at this time, and I stress this time, we're not collecting payments at this time, but we will probably be working on that process moving forward. But at this time, we're not collecting payments, and so that is not needed at this point in time.
And it sounds like the phone call is going to be quite comprehensive. So everything that a person will need to know for their appointment will be discussed on the phone call, or they'll have ample time to ask questions on that phone call.
Absolutely. Yeah, absolutely. We'll try to answer any questions available. And if the person on the other end of the phone is not able to answer the call, they will forward those questions on to myself or part of the pharmacy team, and we'll get the answers back to them as soon as possible.
Oh, excellent. So there's always an opportunity to have your questions answered.
Absolutely. Yep.
Perfect. And between receiving the phone call or speaking on the phone with someone from MDI Hospital and actually having the appointment date, should I expect to hear from MDI Hospital again in between those two times?
So probably not, unless we have to cancel your vaccination due to weather or to limited supply of vaccine didn't come in for some reason. Something that we would be completely out of the ordinary, we'd contact you to cancel. Because we're scheduling on Friday and Monday, those appointments are for that same week that we're calling the schedule. So we usually schedule our first dose appointments for Wednesday, Thursday, and Friday. So it's a very short turnaround. We apologize for that, but that's based on when we know how many doses we'll be getting from the state. And so it's a very quick turnaround, and we just hope that you're able to get there and come. If you're not able to come, we do ask you to please email the COVID vaccine at mdihospital.org, and that'll allow us to know that you're not coming and fill that in with somebody else. Great.
So in between, if you do not hear from MDI Hospital, you should just show up for that appointment. Unless
absolutely,
whereas we
come on in. Yeah, if you were given a confirmation of a date and time and place, come on in and get your vaccine. We'll be ready for you.
What was the email that we should be emailing if I am scheduled and I need to cancel my appointment? Can you say that one more time, the email address?
So it's COVID vaccine, COVIDVACCINE at mdihospital.org. And
why is it important for me to email that if I do need to cancel?
That will go to that goes to our scheduling group, and that'll allow us to update all those records and keep us organized. So if you have any questions about your vaccine, if you want to verify a time, that email is really the way to contact us, so we can get that information back to you in writing and really make sure you have accurate information.
Excellent. What about place? How will I know where to go for my vaccination?
So we'll tell you over the phone. If you forget for some reason, please email us, or you can call the COVID hotline. But just follow the instructions. So if it's at the Regency right now, you're going to come right in the front doors, just like you would if you're checking into the lobby. You're going to come right in the main lobby there, and we'll be there to help and assist you through the process. There's no need to call ahead to come in. Just come on in, and we'll get you all set up.
I think most folks these days do have a smartphone that has a GPS on it, so they can log in the Regency. But for those who don't have smartphones, can you explain sort of where the Regency is in Bar Harbor?
Well, it's at 123 Eden Street in Bar Harbor. So you can find it by that, or it's as you're coming into Bar Harbor on Route 1, it's right before the CAT terminal. most people know where the CAT terminal is. It's right before that on the left-hand side. There's a big blue sign that says the Regency, Holiday Inn Regency, and come on in. You'll see cars usually parked there, and we'll be ready to vaccinate you.
Perfect. And are there any other places where the vaccines are being administered right now other than the Regency?
Our health centers are doing a small number of vaccines each week. If you're scheduled at one of those locations, that'll be done during the process, and you'll be told which site to which health center you'll be going to get that vaccine.
If I happen to be one of those people, and if I forget which clinic I'm supposed to be going to, who should I call to get a reminder as to where I'm going?
You can call the COVID vaccine hotline or email the COVID vaccine at MDI Hospital to get that response.
What if I forget to go to my appointment?
If you forget to go to your appointment, it kind of puts you back to where you're going to need to call in the schedule again at the next opportunity.
So I will get another chance.
What was that?
I will get another chance if I forget.
You will get another chance. Absolutely. We're not going to carve anybody out. We are just going to ask you to call back into the line and get yourself rescheduled again for a time and date that you can make the appointment. So.
Okay. So you essentially start over, call in again, apologize profusely. Excellent. So assuming that I don't forget about my appointment, because I don't think many people are, it seems like all across Maine, we have folks driving extreme distances just to get anywhere that will give them the vaccine, which is a great response for our state. But assuming that I am going to my appointment as planned, what should I wear for clothing?
Like we talked about earlier, short sleeve shirt or some shirt that we can easily get to the upper arm. If it's tight, it makes it very challenging. So if it's loose fitted, or we can pull that sleeve up and get to your upper arm to get the vaccination, that's the best thing that we can do. Even if it's a sweater, you can take off, so we can get easy access to the arm. That's fine as well. But we know it's cold.
Oh, go ahead.
But we know it's cold, but we definitely want to have easy access to help us be efficient.
We're Mainers. We have thick skin.
Yeah, absolutely.
So why up high on the arm? How high up are you talking when you say lift the t-shirt up?
It's about 3 fingers down from this little bony protrude that we all have on our shoulders. About 3 fingers down,
Okay.
and that's just a good muscle. It's an intramuscular injection, and that's the location where we want to give intramuscular injections into arms, and that's the best spot to do it, and that's where it's all been tested. So that's really where we want to give that vaccine.
Excellent. And when the day comes for my appointment where I am showing up for arrival, is there a procedure to follow in terms of that arrival for parking, for walking in? You said you don't have to call before you arrive or when you arrive. Is there anything else I would have to do?
If mobility is a challenge, we invite you to pull right underneath the awning. Currently at the Regency, based on our current setup, pull right underneath the awning, get out and come right in the front doors. That just, if there's bad weather, those types of things, that makes it a lot easier. We ask the person that is driving to go park the car and then come in, but we'll have people there to assist. If you do need help with a wheelchair or something, just wait a second, wave, and somebody will be out to help you with a wheelchair, and we'll help get you in and get you taken care of.
That's wonderful. How crowded will the vaccination sites be? Should I be concerned about exposure there, or should I double mask?
We're moving people through there pretty quickly. We do have proper spacing throughout, and we'll continue to try to make that a better process as we move forward. So if you've already been there, it's even better now than it was in the past. So we're continuing to make our use of the space better, and we've expanded our space as well. So there should be plenty of space. We do recognize that some people have not left their homes for a year now, and it may seem crowded because we are putting a lot of people through, but we are maintaining space, and we are maintaining those cleaning procedures that need to be handled throughout the process. If you feel like you'd like to double mask, you're more than welcome to. We're not going to tell you not to. We're just going to encourage that you do have a mask on it, and we'll move you through our process as quickly as possible.
Not to mention that every staff member is absolutely following proper guidelines and what they should be wearing and how they should be sanitizing and washing their hands. So that would actually probably one of the safer places to be, really.
Yes, absolutely.
Great. A really popular question for vaccinations. Do I go in alone?
If you can, and if you can, that's great. If not, you're welcome to, if you need help or somebody, one companion can join you through that process and come with you. We know that there's some mobility assistance, or if you need assistance in other ways, we're more than welcome to one other person to join you through that process.
That's great. As far as going to the Regency, because it is going to be more popular, more likely rather, that someone is scheduled at the Regency than a health clinic, can you paint a picture of what I would expect upon walking in?
So when you're going to come in, you're going to see some smiling faces there. We're going to do the initial screening. They're going to take your temperature. They're going to ask you the travel questions and the questions that you're familiar with, how you're feeling, if you've had COVID, if you've been exposed to COVID, all those types of questions. And then you're going to get some paperwork that needs to be filled out. That paperwork is really saying that you understand that this is emergency use authorization medication. Also making sure you don't have any contraindications to the vaccine, which are very, very few. We haven't had anybody in the over 4,000 doses we've given. We haven't had anybody with contraindications to the vaccine to date. And there will be people to assist if you need help filling out that form. And then you'll be kind of put into a chair and move forward and you get your vaccine. And then after the vaccine, you'll be guided into a waiting room where we'll get you scheduled for your next dose. And we'll get your information entered into the main state impact where we have to record this information. We'll ask you to wait for 15 minutes and then you'll be on your way and set up for your next dose.
So easy.
That's our goal. That's our goal.
Do I need to bring my insurance card or any forms of payment to the vaccine site?
No forms of payment, but we do ask at this time, but we are asking for, we do need proof of main residency. And if you're an educator, K through 12 educator or healthcare worker, that you bring documentation that proves that you're licensed or that you work at, proves it, like you work in school or it's your licensed healthcare worker.
And no insurance card or yes to an insurance card?
No to an insurance card at this time.
That's great. Easy. Pack light. Do I need to bring any proof of state residency or proof of date of birth? You just covered that a little bit, but I just want you to formalize that one more time if you could.
Yeah, definitely. If you can bring a driver's license is preferred. If you don't have a driver's license, we will take a bill, an electric bill or something like that that shows that you are a Maine resident. We do ask that if you have a summer home on the island or anywhere in Maine, but your primary residency is out of state, that you not come to one of our vaccination clinics and you go back to your state of primary residence for your vaccine. That's what the state is asking for all of us to do, because the allocations of vaccine is being done upon the census in the state that's your primary resident.
So those were very procedural based questions for details on how to enter the vaccine site, what to expect, what you bring with you or don't need to bring with you.
Mm-hmm.
I want to change gears a little bit and switch to talking about the vaccine. Which brand of vaccine does MDI Hospital have right now, and why should I feel good about receiving that brand?
So currently we have the Moderna vaccine. It's an excellent vaccine. The science is very good on it. Any true adverse reactions are very, very low. People may expect an immune response, same immune response they would expect with any of them, but it's a great vaccine. It's a 2-dose series, and we really have had very, very little issues with it. It's very stable and it's worked quite well. There is potential down the road that we could have Pfizer or Johnson or Janssen vaccines, but we don't have those at this point in time. So far, we've only received Moderna.
How big is the needle?
The needle's a 1-inch needle. Just so everybody knows, the length of the needle is not what causes pain. It's the
1 inch wide or 1 inch long?
1 inch long. That's not the part that causes pain. The pain is really the gauge of the needle. It's a very, very small needle. It's even hard to see. I brought an example and put this behind it. Maybe you can kind of see it in there. But it's a very, very small needle, 25 gauge. But it does, I'll try to move it a little bit forward, but it's very, very small. The housing is bigger than the actual needle. And,
what is the housing? Can you explain that a little more?
That's this orange piece.
Yep.
That's a safety mechanism, just so we don't stab ourselves, but it's a very, very small needle. And it's a great way to get that vaccine.
Can you explain the process of physically getting the shot? So when you're sticking that needle into someone's arm, detail by detail, how's that gonna happen?
All right, so the nurse or whoever's vaccinating is going to bring you back, sit you down in the seat. They're going to go through your paperwork and make sure it's all filled out, make sure you don't have any questions. They're going to get access to your arm. They're going to use an alcohol pad. They're going to have fresh gloves, clean hands. They're going to have goggles and a face mask on. They're going to have a Band-Aid and vaccines all ready for you. They're going to ask you which arm you want your vaccine in. There's a lot of different ways people choose their arm, but it really doesn't matter. Once we know which arm you want it in, your arm will be cleaned with some alcohol. Give it a second to dry. The nurse will talk to you. They're going to probably ask you to dangle your arm down to loosen that muscle up. If that muscle's tense, it's going to hurt more. It's going to hurt. This vaccine really doesn't hurt at all. I've had my complete series and didn't have any pain. They're going to come in. They're going to give you your vaccine. It'll take a few seconds. You won't even realize it. And most of you will say, I didn't even know you gave it to me, which is fantastic. That's what we want to hear. If need to, we'll give you a Band-Aid. We'll pull your sleeve down and you'll be all set to go to the next station for the vaccination process.
And for anyone listening, I do want to emphasize what Dr. Casey just said. I have seen a bunch of folks that have received it and they go, you already gave it to me? It's done? And they're thrilled, basically skipping out to the waiting room.
Yeah, so, and it's a very positive attitude there. We're excited. Everybody's excited to get people vaccinated. That's our goal.
So moving from getting the shot in one room and going back into the waiting room, after I've gotten the shot, can I leave right away?
No, we do ask you to wait. We do ask you to wait for about 15 minutes. If you have a previous experience of anaphylaxis to a medication, not to a bee sting or hay fever, but to a medication, then we will ask you to wait for 30 minutes. And if you don't know what anaphylaxis is, then you probably haven't had it. But we will talk to you about it. We'll talk to you about what that means. If you have any questions about that, we'll make sure that you're monitored. We want to monitor you for about 15 minutes. Part of that time is signing up for your next dose and doing your paperwork. It really goes pretty quickly, and we'll get you. And then as soon as your time is up, we'll get you out of there and on your way and ready for your next dose.
And we will talk a little more about reactions and symptoms in a little bit here, but as far as the registration of this vaccine and being in there, moving to the waiting room, waiting for 15 minutes, registration gives you a card for the day's vaccination information and the next date of the booster shot. So what do I do with the card? What if I lose it? What does the card look like?
So I brought a sample, and again, it's a pretty small card. It's bigger than a wallet size. I wish they would have made it a little bit smaller, but it is bigger than wallet size. So it's going to have your name, your date of birth. So you want to keep that. It says, I really mind. And then you're going to have your first dose written here, and you have your second dose written here. After your second dose, there'll be a signature or initials by the nurse or whoever administered your vaccine, pharmacist, whoever it was. On the back is where we're going to write your schedule for your next appointment. And so that way you have it written down for you. You're going to choose your time and the place or the time and date that we have available for that second dose. And you're going to want to keep this card with you. This is going to be important for proof of vaccination. If by chance you lose it, we are asking you to contact your primary healthcare providers. They should be able to get you the dates when you were vaccinated out of the state impact and have that information for you. But you want to keep this with you.
Oh, sorry, go ahead.
No, you're fine.
How would the PCP know about that information?
They can look it up in Maine State Impact to get that information.
Okay, so they have access.
They have access to that database, yes.
Wonderful.
And then we are suggesting that if you have a cell phone, take a picture of it. It's a great way to make sure you have proof as well.
That's a great idea. And so the other information, there's some paperwork that stays at the vaccine site, and that paperwork has similar information to what's on the card. So essentially, both parties have a copy of the same information.
Yeah.
Okay. So keep the card or take a photo.
Please keep the card. Yeah.
I'm going to take a photo of mine later today. So assuming I wait the suggested time and everything looks good, what symptoms should I expect to experience? Otherwise, what's normal for me to feel from the COVID-19 vaccine?
Well, definitely most people experience a sore arm. Beyond that, for the first dose, There's not many side effects. Some people will have some fatigue, some muscle ache, so they might feel tired, a headache, maybe a slight temperature, and maybe a rash, a small just rash or red swelling around the injection site is common for the Moderna vaccine. It's nothing to be worried about. If it expands and goes throughout your body or becomes hives, raised, bumps, that you're definitely going to want to contact your primary healthcare provider. Most people don't have any reaction after the first. We do see a higher reaction rate after the second dose. You've probably heard about some of people's horror stories, and those really aren't adverse reactions. Those are immune responses. And so, but after the second dose, more people just have fatigue, muscle aches, headaches, and just general soreness throughout their bodies. I've had both of my doses. I just had sore arm on both of them. That was it. My wife had a little bit of a slight temperature and some body ache. It only lasted about 12 hours and it went away and she was good to go. But that is a good sign that your body is doing a natural response.
And so the reason that you may have increased soreness in your arm from the second or the additional shot, is that because you're receiving increased immunity from the additional shot?
Yeah, your body recognizes it, and you're seeing that immune response to that second vaccine and that booster dose, which is very important. If you don't get it, it's okay, but some people will get it. About 15 to 20% will see that response on the second dose, where only about 3% see it on the first.
So normal to have a slight response, normal to not have a response.
Very normal on both, yeah.
All right, let's talk a little bit more about what's abnormal. Is there any symptoms that are definitely abnormal and I should report if they happen to me?
If you start to feel like you're getting hot, dizzy, sweaty, like you can't breathe, those are things you're going to want to report immediately at the vaccine clinic or on your way home. You're not going to want to wait on those. You're going to want to get immediate medical care for any of those type of symptoms. That's a very, very low risk of that happening. But if it does, seek immediate medical attention. If you get to the point where you have hives throughout your body, you continue to be sick, those types of things, you have a high temperature for several days, you're going to want to seek additional medical treatment from your primary care provider. Call them and report that you received the vaccine, and then really follow up with them to make sure you're okay.
So who again do I bring the concerns to if I have any?
Your primary medical provider.
And they're going to instruct me on what to do next.
Yeah, they'll take care of you from there on how to take care of that process.
Excellent. You talked a little bit about this earlier, you touched on it, but how many people are actually having adverse reactions to the vaccine? Is it likely to happen to me?
So we're seeing, about 3 people out of 100 are having a side effect with, one of the additional side effects besides sore arm, where they feel a lot of fatigue and downtrodden a little bit after the first dose. About 3 people out of 100. On the second dose, we're seeing anywhere between 15 to 20 people out of 100 that have those additional symptoms: the fatigue, the tiredness, maybe a slight fever. And so, if you're one of those lucky 15 to 20% on the second dose, we apologize, but it definitely means your immune system's working well. So.
And even so, it's not an intense abnormal response. It's just a response.
No, you may not feel well for about 24 to 48 hours. But after that, you should be back to normal and ready to move forward and on your way to being completely all vaccinated and taken care of after 14 days after your vaccination.
Great. So Moderna right now is a 2-shot process. Now that I'm half vaccinated, how does that change my day-to-day lifestyle?
Half vaccinated doesn't change anything in your day-to-day lifestyle. We ask you should still be masking, socially distancing, doing everything you're doing now to protect yourself and others from COVID.
What about when I'm fully vaccinated? Can I return to the way things used to be then?
So we're getting a lot of new information about this, and there's a lot of reports. And so 14 days, and this is very important, 2 weeks, 14 days after your vaccine, the federal CDC has stated that you can have private small gatherings, unmasked without social distancing, and with other vaccinated, very, very important, with other vaccinated or low risk individuals. The Maine CDC hasn't given us guidance on this, and we're waiting for that. So really, this is still in limbo, but that is guidance out there, but we really are waiting for the Maine CDC to give us additional guidance for the state of Maine.
Why do we need to wait to hear from the Maine CDC on that?
Well, it's to see if they support it and they know our numbers and what our levels of COVID look like throughout our communities. And so they're giving us good guidance to try to protect our communities and our individuals everywhere throughout the state.
Okay, so in simple terms, that may not apply to us just yet. Okay. But another question for you: what general safety practices will I need to continue even after being vaccinated fully by any COVID-19 vaccine brand?
So anytime we're out in the public, we need to, again, this is changing. And so please look at the Maine CDC website for any additional information, but masking, social distancing, and then just look at state guidelines as these things are constantly changing for updated information on what to do. But really, we need to continue doing what we're doing to protect ourselves and those we love in our communities.
And it looks like we have time for one last question here. Do I need to tell my primary care or any other healthcare facility that I have received the vaccine once receiving it? Either dose.
Absolutely. We ask you to take your card, take your primary care providers with MDI Hospital. That's great. We are updating your medical record, but we still ask you to bring your card, let them know during your appointment. If your primary care provider is somewhere else, get them this information. They'll want to know that you're vaccinated and that you're being taken care of. And that'll be good information to have on your medical record. And so it's recorded for the future.
And they'll know which information to take from you as long as you have the card.
Absolutely. Yep.
Perfect. Is there anything else that you'd like to share with us today? Numbers, anything that's recent updates?
Well, we're just grateful. We're just grateful for everybody. And when they're coming to the clinics, everybody's been so grateful, and we've loved working with you. Just to date, we've given 4,114 doses through our little vaccination clinic, and so we're proud of that. That's 2,769 people that have received first doses, and 1,345 people that are completely vaccinated have received both doses, and that's in 12 weeks. And so we're excited about the future. We're excited about increased volumes of vaccination availability, local pharmacies having the vaccine as well. We really want to get through all the groups as quickly as possible. If you're in one of these younger age groups, please be patient and know that we're going to get to you as soon as we possibly can. And as we're able to get these age groups, everyone vaccinated that wants to be in these age groups, we're going to be moving on to these next age groups for the state guidance, and we'll get you vaccinated as quickly as we possibly can.
Oh, thank you, Dr. Casey, for offering your time and your expertise in answering these frequently asked questions. I hope they've been helpful to provide some clarity on how MDI Hospital is running the vaccine registration in clinics.
Thank you so much.
Yeah. And that's all that we have for today. Again, the information that we discussed earlier, it may change by the time that you listen to this. If you'd like to confirm any information or if you have any questions relating to the COVID-19 pandemic crisis, please call 211 or visit our website at mdihospital.org. Thank you for joining us today and stay safe.